Magandang umaga po sa inyong lahat, lalo na sa tagapakinig at sa mga student nurses at sa kapwa ko na nurse at sa mga clinical instructor na kagaya ko rin po. Ang pag-uusapan natin sa ngayon ay ang pulmonary congestion secondary to ESRD secondary to CGN. Ito ay ang medical diagnosis na kung saan ang ibig sabihin po ng secondary to ay ang dahilan. Kumbaga, pulmonary congestion na ang dahilan ay ang end-stage renal disease na ang dahilan ay ang chronic glomerulonephritis. Ibig sabihin, kinakailangan nating ipresenta ang medical diagnosis na ito sa pamamagitan ng NPD or Nursing Pathophysiology Diagram na magsisimula sa chronic glomerulonephritis hanggang makaabot sa pulmonary congestion. After all gathering of factors for chronic glomerulonephritis, it has to classify accordingly if it is predisposing and precipitating factors. I have 4 factors. 3 of them are predisposing factors such as age and gender, intake, and vices, and 1 is the precipitating factor which is immune response. Looking at the intake, I identified 4 factors. These are junk foods, canned goods, and others. NSAIDs, eating too much meat and cold drinks. For vices, I have drinking beers and smoking. Knowing the effects of these factors, we can ask questions like how NSAIDs contributes to the development of chronic glomerulonephritis, how age and gender has something to do with the development of chronic glomerulonephritis, how drinking beer and smoking affecting the glomerulus or nephrons of the kidneys, or how immune response got involved in the chronic glomerulonephritis. These questions are helpful enough in knowing the entire disease process of chronic glomerulonephritis. As you can see on the screen, those written in green color are the effects of the factors. It is simplified by rephrasing it, but the entire thoughts as presented by different sources are all intact. As we can see it again, we don't have to write in paragraph form, but by clustering for better understanding. All of those are very important for us to pinpoint one common denominator, just like what is presented in the diagram. Just wait for a moment, please. There you go. I would like to read the common denominator. Though there is kidney problems, the patient will not experiencing clinical manifestations, that's what we call symptomatic, and never sought for consultation or a clinical consultation. Therefore, there is progression of renal damage and affecting its functions. Then the first one functions that we need to talk is regulation of extracellular fluid, osmolarity, ion concentration, and pH was already affected. Therefore, it can lead to the clinical manifestations such as elevated BP and the rest of the clinical manifestation. Then the second one is affected excretion of waste and toxins. Expectedly, the patient can identify himself with a positive protein in the urine, of course after the laboratory test, and expected to have a high level of BUN and the rest of the clinical manifestations. Next is the affected production of hormones, low renin, low erythropoietin, and low calcitrol. Then the other one is affected filtrations of mineral. Therefore, we can expect that the patient is having a reduced reabsorption of minerals or electrolytes and water. And because of these clinical manifestations, this became the reason for a patient to consult for a doctor to have a checkup. And while the doctor is assessing the patient, we can expect that the doctor can look for a diagnostic tests. So what are those diagnostic tests? Diagnostic test is classified into 2, the laboratory test and the imaging test. In presenting the diagnostic test, it has to be defined or described, including the indication and the nursing consideration. Then what would be the result of that diagnostic test? Therefore, there is a chronic glomerulonephritis. Chronic means a long years of having inflammation of the glomerulus or the nephrons. Next is a common denominator again. Untreated glomerulonephritis in chronic form resulting to serious damages of kidney regulation, excretion, filtration, and production of hormones. Then it can lead to a more serious of damage of the functions. Not only the physical aspect of the kidney, but again also the functions of the renal system. There is the decreased production of erythropoietin, which supposedly erythropoietin provides protection of the RBC once it is already in the blood circulation. And the RBC will be properly produced once erythropoietin stimulated the bone marrow. Then because it is already affected, it can lead to different kinds of clinical manifestations such as shortness of breathing and the rest of the clinical manifestation. Then the next one is decreased calcitrol. Calcitrol helps the calcium get inside the bone. But since it is already affected, there is a high level of calcium in the blood circulation that can lead to clinical manifestations, high PR, high BP, and the rest of the clinical manifestation. Then the other one is decreased renin, inability to regulate the blood pressure. So difficulty in controlling a high blood pressure of the patient. Then the last one is severe malfunctioning of GFR. GFR is glomerular filtration rate, is the best indicator whether the patient is having a failure or not. But this time, in this case, the 15% or less, that is an indicative of a serious renal kidney failure. And because of the clinical manifestations and look at the last, too little or absence of urine production, it can directly lead to the diagnosis or the end stage renal disease. Now, you already know how the end-stage renal disease happen. It is originately due to or a complication of chronic glomerulonephritis. Now, let's proceed with the other topic. Here we go, another common denominator. More and more filtration and excretion damages. There is excess of fluid retention to different parts of the body, and the respiratory system is included. Respiratory system functions are affected. So the first function, the regulation of the acidity as the buffer system is also affected. That can lead to the different kinds of clinical manifestations. Heartburn, feels acidity, and the rest of the clinical manifestation. Then the second one is gas exchange. It is obviously affected with the process of carbon dioxide and gas exchanges. That can lead to different kinds of clinical manifestations, difficulty breathing, shortness of breathing, low capillary fill, and the rest of the clinical manifestation. Then the third one is inspiration and expiration is also affected. That can lead to the patient to experience chest tightness, shortness of breathing, difficulty of breathing, and the rest of the clinical manifestations again. Because all of these clinical manifestations, it can lead to again the continuity of the diagnostic test. Here we go. So that's it. So these are the diagnostic tests. Until such time, they can lead to the pulmonary congestion. Here we go. Pulmonary congestion. Then let's proceed with the if treated and if not treated. The management is divided into three: the medical management, the surgical management, and the nursing management. I have here hemodialysis, peritoneal dialysis, continuation of tests, and the rest for medical management. I have also here for surgical management the thoracentesis, paracentesis, even the kidney transplant, then the different kinds of the nursing management. Referring back to the medical management and surgical management, the clinical instructors and even the student nurses using the 7-in-1, they need to describe or define then the indication and the nursing consideration. Referring to nursing management, we should not limit the student nurses for them to know almost everything, but at least we can teach or taught them on how to prioritize 5 items or 5 priorities. And then if not treated, poor financial support, limited of finances, not cooperative, until such time that we end up with the 7th technique. That is the prognosis. Hanggang dito na lamang po at sana naman po marami kayong natutunan kung paano ipresenta ang ganitong klaseng medical diagnosis. pulmonary congestion secondary to ESRD, secondary to CGN. Sana naman po pwede ninyong magamit ang 7-in-1 technique bilang isang clinical instructor at bilang isang student nurses. Malaking tulong po talaga ito. Daghang salamat. Signing off, Bonggits!